patients to use the CPAP and continue using it. Right? As you can see, surgery success rates are not really fantastic, right? So we do have to tell all our patients the option of CPAP and try to get them to at least have a reasonable attempt at using CPAP before we go on to surgery. Right? Eugene?
Thank you, one and all. Thank the organizers for this to let me share this on CPAP. Alright, when they first started and told me about CPAP, I thought it was going to talk about the algorithms and all sorts of things, but I think that most of you all down here would have already known what the algorithms are. You know, basically, my talk here will be talking more of, there are two aspects that you should actually consider when the patient comes to us. Right? One aspect on the left, you'll see that there is mechanical and technological advances. So you use mechanical to change from the CPAP to the BiPap, you have all your RAM starts, your algorithm changes. But the other aspect, which is actually, I feel is a little bit more important after these few years coming out, is on the psychological methods of how to handle the patient falls using CPAP. Okay? We take this as an example. Right? Some of you all might know what this is. It's Elizabeth Kubler-Ross thing. It's really defining on about a bit of the cancer. But you just imagine that a person taking it for using a CPAP. First, you get a shock stage, you know. Then you get the denial stage. Why must I use this CPAP? After that, an anger stage. Frustrated, and why me? I have to use this device all my life. Then you get into a bargaining stage. Doc, can I use it for 2-3 days? And then don't use it for a while. I need to use it for when I go traveling. I don't really want to take this. All right? Then you get into a depression stage. Finally realizing the inevitable that they have to use it. Then there is the testing stage. And finally, you get the acceptance stage. But this is actually not the end. This is actually only the beginning and the start. Right? Just a little quick cap for technological things. There are usually about 3 types of CPAPs. There's a continuous positive airway pressure, which is a fixed CPAP, or some of the papers that you see is nasal CPAP or FCPAP. The next one, more commonly in our area that we use directly straight away, is automatic positive airway pressure, which is automatically helping the airway when you toss and turn airway. Finally, you use the bi-level positive airway pressure. Just now, Dr. Mark actually alluded to using another thing, which is BiPap Auto SV, and that's usually used for people with central sleep apnea. But due to some costs, and most of the time, you can actually solve these central issues just using the automatic CPAP or the bi-level as well. Right? So what is an automatic positive airway pressure machine? It's basically a flow sensor, a pressure sensor, and it detects the resistance within the airway. All right? The microprocessor, flow sensor, will detect a resistance in the flow of the machine and determine if it is a flow limitation, an apnea, a hypopnea, or slow, and then respond accordingly to changing the pressure. But the main objective of what a good CPAP is to look for the lowest pressure to overcome the obstruction. Right? This is a little small chart that tells you what happens when you have flow limitations, hypopnea, obstructive apnea. A BiPap, okay, a normal BiPap, will just close first the obstructive apnea for the EPAP, and then flow limitations and hypopnea for the IPAP. The next is a CPAP. You have a BiPap Auto now by Philips that gives you the variation, where you can vary the IPAP and the EPAP. Note that all these things are still spontaneously breathing patients. Okay? We're not giving any backup rate to this aspect of BiPap and CPAP. Okay, the theory of operation is that a good CPAP will have to do these things. As you see, the upper airway, the palate, moves up. There are 2 critical points that we will have to look for. One is the P critical and P optimal. What we want to search is basically the machine should search for only the P therapy stage.